And welcome. It's Friday, so it must be Kinetics USA weekly show, Onward and Upward. Everything that a healthcare worker needs to know about coming to live and work in the United States. I am your host, Tanya Friedman, president of Kinetics USA, part of the AMN family, the #1 company for direct hire, bringing healthcare workers to the United States. Our topic today is our client showcase, and we are very excited to present to you one of our prestigious organizations, UofL in Louisville, Kentucky. I am joined today by the UofL team. So we have Shari joining us, Mandy, Faith, and Beatrice. Welcome, everybody. Very excited to see everybody today. And today we're going to find out more about UofL. We're going to be finding out more about Kentucky. What's it like to live in beautiful Kentucky? We're going to find out more about Louisville. We're going to be finding out about the organization. We're going to have facility spotlights. We're going to be finding out about the international nurse program, why they decided to do it, speak to two of their international nurses who are going to be sharing their experience. Lots and lots and lots to dig into, and we are really excited to speak to the UofL team today and find out more about it. So if you are joining us now, please put your name into the chat and let us know where you're watching from. I see we have Philip who's watching from India. Please put into the chat where you're watching from and if you have any questions for the UofL team. And if you are interested in applying to Kinetics USA, please apply to our website, and our team are on hand waiting to speak to you and see how we can help you make your American dream a reality. Ulif Fasayo is saying hi from the UK. So let's welcome the UofL team. Hi, everybody. Welcome.
Thank you. Thank you for the opportunity to speak today. This is a great forum and what great information to get out to all of the healthcare workers across the world. So thank you, Kinetics, and thank you, Tanya, for doing this today.
Of course. Well, we're really excited to speak to the team and find out so much more about the organization. Let's start off with introductions. Shari, do you want to go ahead and introduce yourself?
Sure. I'm Sherry Kretschmer. I am the Senior Vice President, Chief Nursing Officer for UofL Health for the system, but I'm also the Chief Nurse for University Hospital. I've been in this role for 8 years and relocated to Kentucky. So super excited. This has been a journey the last 8 years, but it's been an awesome journey. So I'm glad to be here. Thank you.
Thank you, Sherry. Well, we can't wait to dig into your story, find out about why you decided to relocate to beautiful Kentucky, and find out more about your experience with UofL. Mandy, do you want to go ahead and introduce yourself?
Sure. I am Mandy Walker. I am the Executive Director of Professional Practice for the UofL Health System. So I am over onboarding and education for nursing competencies, nursing research, and then nursing excellence. If you're familiar with the magnet designation, I'm over those programs in our facilities as well. Really glad to be here.
Thank you, Mandy. So Mandy's going to share a lot more about the education piece, the programs that UofL have to help international nurses to make the transition, because nursing overseas can be very different to nursing in the US. So we're going to be finding out more about the journey of some of the international nurses that work at UofL. Welcome, Beatrice.
Hi, everybody. My name is Beatrice. I am a registered nurse working at Peace Hospital, offering direct bedside care to patients. I'm excited, super excited to be in this forum.
Thank you, Beatrice. And tell everybody where you're originally from.
I am originally from Kenya, and Kenya is in East Africa. Is one of the most recognized countries in East Africa.
Thank you, Beatrice. And I see Josephine in the chat is watching from Kenya. So Josephine, Beatrice is living your American dream, and you could be one day on screen talking about your American journey. Thank you, Beatrice. Faith, we want to welcome you. Faith, tell us a little bit about yourself.
Awesome. Hello. My name is Faith. I'm based in Louisville, Kentucky, and I work at UofL Hospital in labor and delivery. And so far, it's been great. I also, I'm a part of the Nursing Congress there, where I serve as a representative of all the other international nurses at UofL Hospital.
Okay, thank you, Faith. And tell everybody, Faith, where are you originally from?
I'm from Nigeria.
Nigeria. Okay. And I know we have lots of nurses who watch from Nigeria as well. So hopefully they can see themselves, Faith, in your journey. All right. So let's get started. And I see in the chat there are lots of people joining us there. Chinwe is also from Nigeria. Kadakani, I hope I probably got that wrong, but is watching from Iran. Daisy's watching. Bogwe is is from Uganda, asking if a B1, B2 visa does make a difference. So Bogwani, that is the B1, B2 visa is a visitor's visa, and unfortunately you cannot work in the United States on that kind of visa. And if you look on the Kinetics USA website, there is a success path, which tells you the journey that Faith and Beatrice took in order to come and live in the United States. The success path for nurses takes you through the process. You need to pass the NCLEX exam. You need to have an interview with UofL or any of the other Kinetics employers. You need to get a green card, or if you're a Canadian or Mexican citizen, you could come on the TN visa. You need to get your English proficiency if you are not trained in English, and a visa screen certificate. Then you would come through to the United States, and number 7, enjoy and prosper, just like Beatrice and Faith are doing now. Okay, so let's start off talking about Kentucky. So Sherry, you mentioned that you had come to Kentucky a few years ago. Do you want to share with everybody a little bit about the state? Because a lot of international nurses know about Texas or California, but not many know about Kentucky, except maybe Kentucky Fried Chicken.
So I am originally from a large metropolitan city in the Midwest. And so I was looking to come to an organization that was committed in caring for its community. So when I looked at not only the healthcare system and University Hospital as an employer, potential employer, I also looked at the state of Kentucky. And one thing I fell in love with is just the pure beauty of the landscape in Kentucky. There's rolling hills, there's beautiful horse farms. The horse industry is very prevalent in Kentucky. It is, they actually have a program at UofL, at the University of Louisville, at the college on managing horse farms and managing race horses. So we've got the Kentucky Derby actually coming up in about 2 weeks. I will tell you the feel and the energy in the city just shifts for these 2 weeks leading into Derby. It is very exciting. It's something I've never experienced before. The other part of this is it's this time of year in Kentucky, and it is spring. Spring is beautiful in Kentucky. We have our winters, but our winters are much shorter, and they're not as bad as what I had experienced in the Midwest. Less snow, shorter winter. And when we come out of winter into spring, and in March is when we start to feel the flowers start blooming, the bushes start blooming. This is really a beautiful time of year. And I always fall back in love with Louisville in Kentucky at this time of year.
Well, what a glowing reference about Kentucky. I've been there many times to visit the UofL team, and you are 100% right, Sherry. It is absolutely beautiful, a really beautiful place to bring up a family, and there's a lot of great positives there. Mandy, if we put up that screen again about the Bluegrass State, do you want to take us through some of the pictures on that, on this graphic here, and just share with the rest of the world some of the highlights of living in the area?
Sure, I'd love to.
Did any of these pictures stand out to you?
What was that, Tanya?
I said, do any of those pictures stand out to you? Do you want to share anything about any of the pictures on that graphic about what it's like living in Louisville?
Yeah, so Louisville is what we call a big, small town. It is a city of over 1 million people, but it's not huge. It doesn't take long to get from one place to the next. When you've lived here for a while, you know people. We're right on the Ohio River, so we have the river and a river town feel. because we were a port and that's how Louisville started a long time ago. And there's just things here, Louisville Slugger bats. So there's a Slugger Museum, for baseball. Obviously, we're Kentucky. We're home of bourbon. I don't know if that's of interest to you, but we are the home of bourbon, and there's distilleries and bourbon trails and tastings and everything that you can do here. Sherry had mentioned the Kentucky Derby. Churchill Downs, the racetrack, is here in the heart of Louisville. And there's just so much here. I am originally from Michigan, which is north of here, and a lot more snow, as Sherry said. But when you're here, it is very green. It's rolling hills, it's trees, and just I have friends who live elsewhere, and they're like, they want me to send them pictures of the green in Kentucky at this time of year. So.
They're jealous of the green in Kentucky. Beatrice, had you ever heard about Kentucky before you moved there, and what did you know about it? Oh. You on mute, Beatrice. Beatrice, you on mute.
Yeah, I used to hear about Kentucky, and the most interesting thing is that I did not even know how to spell Kentucky. I used to spell like the way you put turkey. You know turkey? We eat the turkey, Turky. That's how I used to spell Kentucky. I used to hear about Kentucky, but I don't know much about Kentucky until the time I get connected to Connectics. And I started researching about Kentucky when I knew that my nursing assignment gonna be in Kentucky.
Okay, so you didn't know much about it, which is very common with many international nurses, might not have heard very much about it. Faith, what was your first impression when you arrived in Louisville in
It was okay. I moved to Kentucky from Texas, so it was very different. Texas is a very plain, flat land, so there ain't a lot of trees. So when I got in here, it's like, wow, there are a lot of trees here, like a lot of trees compared to Texas. But it also very interestingly reminded me of home, like the actual city that I grew up in Nigeria. And I actually told my mom about it, and when she came in, she's like, no, that's not quite right. This looks more like the capital city. I'm like, okay, if you say so. But my brother definitely did agree with me that it looked like the city that I grew up in. So it's small, just like uh, Louisville is a small city, especially compared to coming from Dallas, which is where I used to live. So that was my first impression of Louisville when I moved over here.
It felt like home. Well, that's fabulous. In fact, we actually have a graphic about all the great things about Louisville that we're going to put in the chat. So as Mandy said, it is a big, small city, but it was actually ranked the 64th best place to live in the United States in 2022 and 2023, the 8th most affordable city in the United States, top 10 for job creation, 8 out of 10 for first-time home buyers, 13 out of 18 for best food neighborhoods. It's a great foodie place. And as Mandy said, it's a big, small city, so ranked 17th largest city in the United States, 3rd of the 10 most hospitable, 4th of the US cities with the happiest workers, lots of parkland. So lots of great things about Louisville. We're going to post that this graphic into the chat. But really some great things about the organization. Let's talk a little bit about the UofL system. Sherry, tell us a little bit about the organization.
So UofL Health, the healthcare system, is really only 4 years old. We came together as a system just right before the pandemic. So it's been a great journey for us. We have now, as a healthcare system, we have 6 hospitals, 7 emergency rooms, and 5 urgent care centers. We actually have the number of licensed beds across the healthcare system is 1,700. And within our healthcare system, because we do so many different things, we have an academic medical center. We have a large hospital that specializes in organ transplants, in cardiac surgery. And then we have a 200-bed inpatient psych hospital, which is actually the largest psych hospital in the state of Kentucky. And just our healthcare system is ranked the 5th largest employer in Louisville. So we are spread out across not only the entire city, but into the surrounding suburban area. So there's great opportunities for you to come and work for us in all the different skill sets and care environments, but also an opportunity for you to grow those skills and to grow your professional practice to where you want to be as a professional nurse.
Wow, that's so impressive. And I think for many international healthcare workers, when they think of coming to the United States, they just think often about getting the green card in the first place that they're going to be working in. But I think the great thing about UofL is that there's so many opportunities. We actually have a new segment in today's show called the Facility Spotlight, where we're going to be spotlighting the different facilities that UofL have a part of the system. And we're going to do our first facility spotlight right now. And
The Heart Hospital at Jewish Hospital is the region's only hospital exclusively focused on comprehensive and innovative heart care. It includes dedicated cardiac cath labs, hybrid operating rooms, 3 electrophysiology labs, and 3 cardiac operating rooms, collectively equipped for TAVR, Watchman Flex, and heart transplant procedures. More than 40 medical heart firsts are attributed to the UofL Health team, including 3 of the world's first transplants and cardiac stem cell procedures, along with a first-in-the-nation procedure to relieve the symptoms of heart failure to improve cardiac function and quality of life.
Wow, very, very impressive. And Mandy, tell us why, what does UofL offer that other hospitals in the US don't offer?
We are, I think, a great health system to work for. We are what would be considered a smaller health system in the United States. We're just regional, as Sherry was saying, in our region, in our area, where there are some literally have hospitals all over the country. But what that offers us is we're local, the leaders are local, the staff are local. We know the patients, the community that we live in. We're highly embedded in that community. But from a working for us standpoint on top of that, so we're affiliated with the University of Louisville, and all of our employees, their dependents and their partners who live with them are eligible to receive fully funded tuition to the University of Louisville for undergraduate degrees. So if you have children who want to go to college, if you have a spouse who wants to go to college, once you work for us for 6 months, you have that benefit that they can go there and go for free for up to 5 years to get a degree. You can as well if you want to go get another degree, undergraduate, but we also have tuition reimbursement if you are over and want to get a graduate degree. On top of that, we offer a lot of certification support. So if you want to become specialty certified as a nurse, we support both the preparation and studying for that, as well as exam fees. And then once you have it, we'll help support the continuing education credits that you need to pay for seminars and things like that for you to maintain that certification. So there's a lot of growth and development opportunities here. I have been here for 19 years. I started as a surgical ICU, actually nursing assistant while I was in nursing school 19 years ago. So, and I have worked my way up through the organization. So there's just a ton of opportunity for growth and development.
Wow, that's so impressive. I mean, that's a very unique offering that UofL actually offer to their employees, and something that's very, very special and really shows the amount of input and emphasis that is placed on the employees of UofL growing themselves and growing their education and their families to have that opportunity as well, which is really pretty unique. Beatrice, why did you choose UofL as an employer?
I chose to work for UofL because it was offering me an opportunity to work in the specialty that I liked. When I was in the nursing school, I had a great desire to help psych patients. And when I applied with the Connectics, they offered me an opportunity to work for psych in a psych facility.
Okay, so they really looked at what you were looking for and were able to find the right match for your career growth and career goals.
Yes.
And that's wonderful to hear. And if you are joining us now and interested in UofL or any other Kinetics employers, please apply to Kinetics USA online, and our team are waiting on hand to help you make your American dream a reality, like Beatrice and Faith. So I see there are some questions in the chat. Let me see here. I saw, so Ron is just saying, my colleague here in the US from Nigeria and Jamaica are all awesome. Nice working with you guys. So there Ron is saying hi. Frida's saying hi from Ghana. Tariq from Pakistan. Mary saying hi. And Chabira has a question. Kachiri has a question. Kachiri is from the Philippines. I've signed the job offer from UofL Peace Hospital through Kinetics. So you're probably going to be working with Beatrice and Kachiri. That's exciting. My priority date is February 2023. Unfortunately, I'm affected with the ongoing retrogression. Still, I'm hopeful that I can go there soon. Kachiri, we're very hopeful that you will be at UofL and in Louisville soon. And yes, there was a retrogression that was announced in the May Visa Bulletin. If anybody wants to know more about that, please check out the show that we did on that recently. And pretty much what that means is that there will be a little bit of a delay in you getting there, but the process continues. UofL is waiting for you with open arms, and we hope that you will be there soon. Midri is from Tunisia, Ezekiel from Nigeria. Mary's also talking about the delay with retrogression, just a delay. Danielle is asking if there are OR positions. Sherry, are there OR positions? You and Mandy are nodding your head. What do you say to Danielle?
Yes, there is OR positions in whatever OR specialty you would like to be trained in. We've got cardiovascular OR, we've got transplant OR, we've got trauma OR, and then we just have at Mary and Elizabeth Hospital, our community hospital, we have just community type surgery. So it's open to whatever your skill set is and whatever area you would like to work in.
Okay, so there you go, Danielle. And that again is the beauty of UofL, is there's so many opportunities in so many different areas. And Faith, tell us why you chose UofL, and also what was your first day like when you joined?
I chose UofL because going off what Beatrice said, was because I got offered a position in labor and delivery. However, that actually changed when I moved over here and I ended up working in the ICU, which was not what I wanted at all. But I will say this though, it actually really helped me develop as a new nurse coming out of nursing school. I learned a lot and I loved all the people that I worked with. And I actually would be picking up shifts in the ICU again, even though I work in labor and delivery. So that's awesome that I get to do that, being able to work in two different specialties, just 'cause I grew to love it. And I remember my first day at UofL. I'm very nervous because, of course, I'm working in as a nurse. I didn't have any of my family members in here. And so I'm like, oh my gosh, what's it going to be like? But I remember meeting, when I walked in, I remember meeting the nurse from night shift. And I walked in and he was like, hi, are you the new person starting off? I'm like, yes. And he showed me where to put my bag, where to log badge in, to make sure that I got paid. And so many, he just introduced me to everybody, and he's like, so you can go wait in the break room for day shift to come in. And I remember that, and all of that experience was like, this is awesome. I mean, these people are very welcoming. And I was able to start off right on and get things going. So that's what my experience was like working at UofL on my first day.
Wow. Well, I think your experience mirrors what so many nurses have told us as well, that people are just so friendly, so warm, so helpful, and there's just so much opportunity. So sometimes life can lead you in a specific direction, like you thought maybe it was labor and delivery, but ICU is where you got your experience. And I love that you had an open mind with that. And that, in time you could go back into labor and delivery if you wanted to. It's just, the opportunities are limitless, which is just so exciting. We have another facility spotlight now. We want to showcase another one of the U of L facilities. And the second facility spotlight is going to come up in a minute, which gives us a little bit more insight into one of the other hospitals of U of L.
Peace Hospital is a private, nonprofit behavioral health hospital. Originally founded in 1951 by the Sisters of Charity of Nazareth, Peace Hospital has been offering hope and care for children, adolescents, and adults with substance use disorder or co-occurring behavioral health disorders. Peace provides a full continuum of psychiatric and substance use services for patients, including specialty programs for children to geriatric patients who have complex treatment needs. Shelbyville Hospital is located on the Colonel Harland D. Sanders Medical Campus in the heart of Shelbyville, just 30 minutes east of downtown Louisville. Shelbyville Hospital offers a full complement of inpatient and outpatient care, including 24/7 emergency care. Shelbyville Hospital is proud to say that through the years, they've been voted as one of the best places to work. The hospital also provides diagnostic imaging, diabetes and nutrition care, general surgery, ICU, pulmonary services, and sleep medicine.
Wow, very impressive. It's amazing, Sherry, how different the different facilities are. Can you talk a little bit about that? Mandy, you're also nodding your head.
Yeah, it's a lot of our services that we have developed over the years is based off of what our community wants to see and what services can we put in place to keep our community here in the city and in the region, because it's tough for a family member that has to travel 2 or 3 hours away for a transplant or for heart surgery or for trauma care. And so we know that it's important for the family to be with their loved ones and so during their time of healing. And so we decrease all of that burden that falls on those families by continuing to reevaluate and offer more and more services to the city of Louisville and really to the region. We just recently at University Hospital got accredited for our adult burn unit. We have a 16-bed burn unit, and it is the only burn unit, not only in the state, but in the region. So that would be almost up to Indianapolis and Cincinnati, the entire west side of Kentucky, and down into Tennessee to Nashville. So we do have a big stretch. So we try to decrease the amount of travel time for the care that the community needs.
Wow, and community, the word community keeps coming into everything that you and the rest of the U of L team are saying. It really is so entrenched in the community and the services provided so vital to the community. So that's really a wonderful thing to see. Mandy, let's talk a little bit about the International Nurse Program. Why did U of L decide to start an International Nurse Program?
I think there were a few different reasons. Obviously, there is a nursing shortage in the United States. But when we were looking at our options, one of our goals and missions as an organization is to have a diverse workforce and one that reflects our community. To say that again, Louisville is actually, I think, number 4 in the nation in terms of refugee landing spots. So we have several ministries in Louisville that bring in refugees and other immigrants. And we have a very diverse population in Louisville. And so to provide optimal care, our nursing population, our staff population should reflect our patient population so that they can see and connect with somebody, who they recognize and who might be able to understand them a little bit more than maybe I would. So the International Nurse Program really helps us meet our mission to diversify our workforce and to look at, who are we as a health system and how can we best meet the needs of our patients. And then also just, really to have that opportunity. I know I've met several of our international nurses and gotten to know them and learning from them and what they're bringing that's so different from how we do things here, I think is a growth opportunity for all of us.
Wow. So, I mean, you're 100% correct. The international nurse recruitment has become a very hot topic in the United States because of the short supply of nurses across the country. But the fact that Louisville and Kentucky is such a diverse organization is something that is kind of unique. Not all hospitals operate in that kind of scenario where they have such a diverse population. Beatrice, did you know that there was such diversity in Louisville before you got there?
I did not know until I got connected to Connectics, and then I started researching, and I came to know that there is this beautiful city that exists here.
Okay, and tell us a little bit about the diversity that you see in Louisville.
I find a lot of diversity, especially in terms of population here, because there are so many people from different countries up here, especially in Africa. From Africa, we have many people, my colleagues. Actually, I find many colleagues at my place of work, and also other people who work at UofL, because we have avenues where we meet. They are from different countries in Africa, and that is something that is amazing, and I like it because I'm able to meet people who come from my home.
Okay, so that kind of feels very, you feel at home because there's so many people from all over the world. And you mentioned Africa, but there are people from all over. I know there, people from the Philippines, people from India, Nepal, all over the world. And Faith, can you tell us a little bit about your experience with the diversity in Louisville?
Well, I would say that living in Louisville, I have been able to meet people from different parts of the world, especially actually our population, the population of patients that we take care of. You get to meet people from all around the country, or sorry, really more like all around the world. We have VRIs, and people who don't even speak English, they speak their language, and we have something what we call VRIs. And what really that is like a virtual translator where we get to, translate. You talk through the VRI to talk to your patient. So it's been nice to be able to meet people from all around the world and also pick up certain things in their languages. Because especially when you converse with them and say even if it's one thing in their language, they feel special. They feel excited to meet somebody who can say at least one word in their language. So that has been really cool. Meeting people, especially at the UofL hospital, the system itself, meeting at that level patients that are from all around the world. And even as a nurse, it's nice meeting people from different parts of Africa just because I'm African. And even though I can't speak their language, because in Nigeria, one of our mostly spoken language is English, even though we can't speak all the languages in Africa, when I do still tell them that I'm African, even through the VRI, they get excited, that they get to meet an African nurse. So that has been very special for me.
That's fabulous. So there's a lot of learning that goes on, not just the learning about from a clinical perspective, but also learning about different cultures and different languages and different ways of bringing the cultures together, which is just amazing. Rebo has a question in the chat. It would have been possible for me to start there by mid-year, but retrogression happened. So Rebo, hopefully you'll start at UofL soon. Question, if you don't mind, are there possible management or training department opportunities for us there? I've enjoyed teaching while in practice. Sherry, are there opportunities for international nurses to move into management or training in time? Mandy's nodding her head.
Yes, Sherry, either one of us can answer, but we actually have what we call professional development pathways for our nurses. So we have three kind of established arms. One's into leadership. So you'd start as a nurse, then charge nurse, manager, up to director, and perhaps beyond if that's what you want to do. We have one for advanced practice nurses. So if you wanted to become an advanced practice nurse, a nurse practitioner, nurse anesthetist, that sort of thing. And then we have one for what we call other specialty nursing. So if you wanted to do quality, infection prevention, education, informatics, so work with our documentation system, we have a pathway for that. So we do have those opportunities. Like I said, I moved up through the organization, and a lot of our leadership were staff nurses first. And so they have moved up through the organization. So definite opportunities for development.
And then the other thing we have in place, and I'll let Mandy talk a little bit about that, is as you're going through this work, actually you get credit for this work. We have a very robust clinical ladder. So the work does not go unnoticed as you start through this pathway.
Yeah, we have a professional development program where by what you're doing, how you're contributing to the organization, kind of going above and beyond your shift. So, Faith said she was the representative for international nurses on Congress at University Hospital. So you get points for doing things like that. And then when you get to so many points and apply and turn in a portfolio, there's bonus money in it, up to $8,000 a year. So,
wow.
Yeah. So there are a lot of those types of opportunities as well.
Okay, so there you go, River. There's the answer to your question. Lots and lots of opportunity. And Beatrice, I know we just had a showcase on Peace Hospital. Can you tell us a little bit about what it's like to work there?
It's so much interesting to work in the Peace Hospital because we have kids units, we have adult units, we have detox units, we have psych acute psych units. So we have various opportunities whereby one can choose where you want to work. If you like working with the kids, we have the kids unit where you can work. And for me, I like adults, and I don't like working with the kids, but sometimes I work with them because I get pulled. But the best thing is that you go to work wherever you want. If you want adults, you can choose to work with the adults. And if you want to work with the kids, you can work with the kids.
And Beatrice just won an award. You
Oh,
want to
she
share
did?
about that, Beatrice?
She's so humble, Beatrice. She's not even telling us. What did you win, Beatrice?
She won a Daisy Nurse Excellence Award.
I won the Daisy Award. I usually keep the sculptor near me all the time. And I have this portfolio that they gave me for the Daisy Award.
Wow. Wow, Beatrice, we feel so proud of you. We feel so proud of you. Congrats. Really, that is
Thank
just
you.
the most amazing, amazing accomplishment. Mandy, do you want to just share what the Daisy Award is all about? For those people who don't know.
Awards are for nurses who just exemplify really going above and beyond in patient care. Typically, they're nominated by either a patient, the patient's family, or it can be by a peer, another nurse or a manager to say, this is what they did. This is how they are just going above and beyond for their patients and really making a difference in the outcomes of our patients. And so everyone at Peace loves Beatrice. I hear about her all the time. So yeah.
Beatrice is famous. Wow. Well, I must say, I feel so proud of both Beatrice and Faith and everything that you've accomplished and all the international UofL nurses. Beatrice, I can cry when I look at you with that beautiful statue. Wow, that is just so exciting and such a great moment. And congrats to both of you on doing such amazing work. And Sherry, how has the international nurse program changed over the years? Because UofL have been bringing international nurses now for a few years. Mm-hmm. How has it changed and evolved over the time?
So when we started looking at the international nursing recruitment plan, it was actually before the pandemic. So we were one of the early ones because there was a discussion among senior leaders, as Mandy talked about, the diversity of our nursing workforce to represent the community. And when we originally started, we were just looking for a pool, just a small number of international nurses. But now we have a commitment of over 600 international nurses. So far today, we brought in about 230 international nurses with the goal of 600. So we are taking a much broader and really creating a lot of resources. When this program started, it was Mandy and Katie Robinson were the two individuals that were supporting the international nurses. Now we have an entire department with leaders, with managers that are there to put their arms around the international nurses when they come in, and help them transition into the United States and into Kentucky. So the biggest change has been the number, and then the number of resources that we've added to this program.
Okay, which is amazing, because it's not easy for an international nurse to come to the United States, especially in those first few months. And there really is a need for resources and for help and support through that time. Faith, what was the first few months like for you when you came to UofL?
It was a bit difficult.
Yeah.
And that was just really because it was hard being away from my family. And moving to a new city. It wasn't particularly anything that had to do with UofL. It was just being away from, people that I knew and I'd grown up with for some time. But it was, I definitely still took comfort in the people that I worked with. They were just very receiving, and I knew that they had my back. I feel like that's a very important thing as a nurse when you're taking care of patients. And for whatever reason, if your patient's crashing that day or things are just not going your way, knowing that you have the right people to back you, and to, whenever you can't be in a patient's room because you can only be in one place at a time, you know that you have these people to, help you and step in whenever that, wherever that is needed, or even in things that you don't know, when opportunities for growth, they're always there to step in and be of good help. So that definitely helped, in that aspect, working at UofL, being able to, meet people that are just there to take the fall for you, in quote. So I definitely love that, working at UofL. And so that's what it was like for me. So even though it was difficult being away from friends and family, it was made better by the people that I worked with, and really the community that I was able to surround myself with as well. I love the church that I go to here at Louisville, and they also served as a great community. Being able to learn some things, and learn where all the nice places are to eat, and the nice places, really the nice places around Louisville. So that was it was like for me coming over here.
I love that, Faith, because I think, you are so right. In the beginning, it's hard. It's not easy. I know I was also an immigrant. I came here from South Africa 23 years ago. And those first few months and weeks are really tough. You miss family, you get homesick, you can feel alone. You can really feel very isolated in that beginning time frame. But having that support system, especially from the organization where they've been through it already, they know how to help you to make that transition, is huge. You cannot underestimate that support, whether it's from the system or from the community. I think let's have one more facility spotlight and show off another amazing organization within the UofL family.
Jewish Hospital provides leading-edge advancements in specialties and services. Located in the heart of downtown, Jewish Hospital is internationally renowned for its proud legacy of surgical services and cardiovascular care. Jewish Hospital is also home to Traeger Transplant Center, a federally designated Medicare heart, lung, kidney, liver, and pancreas transplant center. Mary and Elizabeth Hospital is a full-service hospital that offers a full range of vascular, orthopedic, cardiac, neurological, surgical, rehabilitative, and 24/7 emergency services, including a 24/7 STEMI. It's also home to the UofL Health Weight Loss Care and a voluntary inpatient medical detox unit. Patients will have continuity of care with trusted oncology and hematology providers, along with access to the multidisciplinary care, pioneering research, and clinical trials of the Brown Cancer Center.
Wow, lots to see and so much to learn. I'm just thinking, as we're showing these amazing facility spotlights, because I've been to UofL many times now, and toured a lot of these facilities, and really it's just so impressive to see how many services there are that are available for the community, and how amazing all the people are that work in this awesome organization. And let's talk a little bit about the onboarding and the education of the international nurses. Beatrice, what was the training like when you got to the when you got to UofL?
Yeah, the training was amazing when I came up here. One thing I like is that they offer extensive training, especially when I say about training is about when you come in, they have we have to undergo through orientation. And the orientation they gave for international nurses and the people who just come from school is 16 weeks. It looks like long, but it's worthy. It's good because when you are new, you just come from school or you just come from your country, things are completely new. So that long orientation helps a lot, and that's what I underwent in my place of work at Peace Hospital. I went through that extensive training and that orientation. It took me 16 weeks, and it was so much helping.
Okay. So that made a big difference for you. And Sherry, has the orientation and training changed over the years? Because I know you said in the beginning it was really Mandy and Katie, the educator. And how has it changed? How's it evolved?
I'm going to let Mandy speak to it because she has literally revamped this entire program as it has continued to grow in order to meet the needs of the international nurses as they're coming in.
Yeah, Faith was one of our early folks. So we do have education and training no matter where you're going. So we have an international nurse class that's 2 days. And in that, we talk a lot about what's different in healthcare in the United States, what's different in nursing in the United States. What are some of those things that you might encounter that are different for you so that you can help understand those as you come upon them. And then when you go to your facility and to your unit, there will be facility orientation where they talk about kind of, as you've seen, each facility is different. So what is unique about that facility? What do we do here? And then we'll have classes that are for whatever clinical specialty you're going into. So if you're going into the OR, there would be OR classes. If you're going into the ICU classes, ED classes, if you're going into the emergency department. So you'll get classes for those specialty areas. And then on top of that, as Beatrice mentioned, you get preceptor time on the floor. So you'll be assigned another nurse and you'll work with that nurse for many, many weeks, just getting up to speed. And that does vary depending on experience and how much you need. But we're here to make sure you get what you need because we want you to be successful. And so that will vary a little bit up to 16, 20 weeks even that we have seen from people. So there is a lot of education and onboarding. That's one of the things because we're an academic health system. We very much value ongoing continuing education, but then also making sure we set our employees up for success.
Okay, and it's just not our employees. We also work with our leadership, our nurse managers, our nursing directors. They go through classes on how to lead international nurses. So it's training on both sides of the equation in order to create a culture and an environment that supports everyone in their professional growth.
Okay, so that is very interesting, Sherry, and something pretty unique because a lot of hospitals, first of all, haven't had the length of experience that you've had bringing international nurses in. So you've had that time to refine and to grow and to develop that whole orientation and onboarding process, but also looking at your existing staff and how to help them help the transition and set the international nurses up for success. Mm-hmm. Faith, what was your onboarding and orientation process like?
For me, it included like working in the ICU. It included, having a preceptor that I followed. So I started off on day shift, and I think I was on day shift for about 8 weeks. Then I finished up my orientation on night shift. So I got to, even though I was going to work as a night shift nurse, that's what I wanted. I knew that's what I was going to be doing. Starting off in day shift was good because I got to experience certain things that you wouldn't experience so much in night shift. Just because with UofL being a teaching hospital, most of the orders have to be from the residents. Most of the residents are also on day shift. And that comes in during the daytime. So being able to be updated on your orders is something you receive on day shift versus night shift, that doesn't happen as often. You can almost predict how your night shift will go. So it was nice working on day shift, being able to do that. And there are just some procedures that are done more, like scheduled procedures, scheduled surgeries aren't done on night shift. Those are done on day shift. So that was nice being able to do that on day shift and then moving on to night shift. Um, but again, that allowed me in the event that I wanted to pick up a shift on day shift, I actually knew how that worked and how to do all of that. So that was what my orientation was like. But even as a part of that, or part of my orientation, I also did something called residency, nurse residency, which I did because I had just come out of nursing school at the time. So what the nurse residency program is, it's a 1-year program based on whatever unit that you're working on. For ICU and kind of what it was like being a resident, because it was during COVID, I didn't I didn't get um, the full service of the residency, I guess I would say it like that. Mine was online, so I didn't actually get to meet with my cohorts and do all of that. But I did learn a lot about being a nurse, being a first time nurse, coming out of my residency. We were actually supposed to work on a project, which was going to be something that was so evidence based practice is a big thing with nursing here in the United States, which basically is that whatever thing we put into practice as nurses, there's evidence that backs up that practice. And so one of the one of the things that you do in your nurse residency is that you actually research something, whatever topic that you choose as a team. And because it's going to be evidence based practice, the hospital was also going to adopt that practice because research had gone into that. So that was a part of the residency. Again, we didn't get to do that as much because of COVID and we were short staffed at the time. There was a lot of things that went into that. So that was part of my orientation coming on. And another big thing is classes. So there's something that we call KNOW, which is like a knowledge hub, which is basically you getting updated information on being a nurse. So I had a lot of what we call no modules to do. And so that was the theory part of being a nurse. So I would learn, how to, for example, type in heparin drips and actually do it right. How to prevent DVTs in patients, different thrombosis, being that a lot of ICU patients are always in bed and they don't walk around a lot. So those are just a couple of things that went into know. Also, really just things regarding like policy updates in the hospital, just so that we're aware. And that education doesn't stop there. It actually continues throughout the entire time you're a nurse. We just had like a whole update of no's to do that was due at the 31st of that's due on the 31st of May. And that's really just to make sure that your knowledge is being updated. And in addition to that, now that I think about it, there's actually a lot of things that goes into you.
There's a lot of things, Faith.
As a nurse, so I'm just gonna stop there because as I keep talking, I'm like, oh wow, more
Faith could carry on and on. There's
Tanya.
so much stuff that she learned. I love it. I love the passion that you have, Faith, in sharing with everybody who's watching all of the amazing things that UofL put on your plate to learn and to grow and to experience in order to set you up for success, as Mandy said. So I just love it, and I love the passion with which you are expressing yourself. Really, really so inspiring, I think, for everybody who's watching today. Okay, let's do one last facility spotlight and look at one of the other facilities within the UofL family.
The Brown Cancer Center has been a leading face of world-renowned academic research and cancer care. Affiliated with the UofL School of Medicine, the Cancer Center's goal is to make cancer a disease of the past through cutting-edge care, innovative clinical trials, and cancer prevention efforts. It is nationally recognized for the development of experimental cancer therapeutics and diagnostics and has the largest cancer trials program in the region. Fraser Rehabilitation Institute offers an expansive network of inpatient and outpatient facilities across Kentucky and southern Indiana. Its services include nationally recognized brain injury, spinal cord, and stroke recovery rehab programs accredited by the Commission on Accreditation for Rehab Facilities. Fraser Rehab continues to be on the cutting edge with many other rehabilitation services, such as the Emerge program, which is designed to help patients with severe traumatic brain injuries.
Okay, I'm just looking at the clock and I'm like, oh my gosh, I've got so many more questions and there's so much more to talk about. And the clock is ticking. I wanted to just answer this question though from Arabi, because I see Arabi's put the question in a few times. I'm a Bangladeshi nurse. I want to go to America to study post-basic bachelor's and master's. I want to study in an American university. You will help me. So Arabi, if you want to come here on a student visa, that is a different visa to what Beatrice and Faith would come on as a green card nurse. And we have done shows before on student visas, so please look at those shows and we'd be happy to share some information with you about how you can come here on a student visa. Okay, so Negin is saying, I just passed both my NCLEX and PTE 3 days ago. Congratulations, Negin. And immediately applied with Kinetics USA. Yay. We are excited and really looking forward to work with you and start my progress as soon as possible. Appreciate it if you will consider me. So Negin, we'd love to consider you. And I know you've been hearing all the amazing things about UofL. So we'd be very happy to speak to you about that and see if we can put you in touch and get you living your American dream like Beatrice and Faith right now. Okay, I'm looking at the clock and we've got so much more to ask everybody, but the clock is ticking and we're almost at the hour. So I think maybe, Sherry, do you want to maybe just talk a little bit about the magnet status that with UofL recently applied?
Yeah, so University Hospital is a level 1 trauma academic medical center. And we just recently in December was awarded a magnet certification. It is an international recognition of nursing excellence where nurses at the bedside own their own practice. And as Faith described our nursing congress, which is 43 bedside nurses that come together every month to look at practices, to look at what the evidence shows. And then there are possibilities to change our practice so it's better. It's constantly challenging ourselves, not only professionally, but allowing our nurses to have a voice and they're empowered to speak up and say, you know what, this isn't working. Can we do it differently? We're super excited. This has been a long journey. It's around our nurse sensitive indicators, our quality scores on COTI and CLABSI, pressure ulcers, falls, nursing satisfaction, and patient satisfaction. So the combination of all three that we've been working on really the last 8 years has led us to finally receiving this international recognition of a magnet organization.
Wow. Well, congratulations, because becoming a magnet accredited facility is a really tough journey. And I think I think I'm correct that only about 8% of hospitals in the whole of the United States have achieved magnet status. So really an awesome, amazing accomplishment. Olafi Sawo is asking, what is the nurse-patient ratio at UofL? Mandy?
Well, that's going to vary depending on what area you work in. In general, if you're an intensive care nurse in the ICU, it's probably about 2 to 1. If you are out on one of our med-surg floors or what we call mixed acuity that has kind of step down progressive care and med-surg, about 5 to 1, maybe 6 to 1. And then, from there, it really will depend on where you're at and what kind of area you're working in. But usually max on a med-surg is about 6 patients.
Okay, sounds good. And I see Arlene is saying, good morning from Jamaica. I'm late, but I couldn't afford to miss the show. And we're glad that you're here, Arlene, to watch the show, even though we are at the tail end. Okay, so to finish off, I think maybe Beatrice, let's start with you. Why would an international nurse choose UofL?
Yeah, they would choose UofL because after you come here, they'll file for you the green card. That's one thing that they do for you. And then when you get the green card, you are allowed now to work. Although you get into a contract, after you finish the contract, you can work anywhere else you want. But the best thing is that when you work with UofL, you have the opportunity even to advance your career. If you want to advance your academic work, you can still continue, because as we know that UofL has academic training that it does. So that's one advantage, that you can work here and you can go to school still in UofL, as it is offering the opportunities to go to school for the staff and also for their family members.
Okay, thank you, Beatrice. So those are very inspiring words from Beatrice. Faith, how is your life different working at UofL than it might have been in your home country?
So I actually never worked in Nigeria, so I don't know. Because I moved over here to school before I ended up at UofL Hospital. So I'm not quite sure how to answer that question. But from the people that I've spoken to so far that actually do work in Nigeria, my friends and family that work back home versus working here, it's definitely different. Being able to have employers that kind of back you up, as well as are interested in your growth, and also the fact that your work ethic counts. So basically, whatever work you put into something, like Mandy was talking about the professional development pathway. Being able to put that effort in and know that it actually counts for something, and you're going to get promoted versus back home where that's not necessarily a thing, from what I know. And in addition to that, I actually had this discussion with my dad. He asked me, he was like, "Are you sure you want to be a nurse?" And I said, "Yes, I do want to be a nurse." And that really is just because of the the way nurses are viewed in Nigeria versus here. And I would definitely say there's a lot of credibility that comes with being a nurse here in the United States, as well as at UofL Hospital as well.
Yeah, absolutely. Nurses have a lot of respect and a voice, Sherry. I mean, as you said, the nurses are really listened to in the process. And Sherry, what are you looking for in an international nurse?
I'm looking for someone that wants to grow professionally, wants to be part of the team, and one that, is willing to think outside the box. And that's what we're looking for. Innovation, if you're interested in doing research, there's that possibility. Interested in, expanding your education, that's possibility. The possibilities are endless, and I think that's what we're looking for. One that doesn't just accept the status quo, and that's the way it's always done. So someone that can challenge us, and we can challenge them.
Fabulous. Opportunity to learn and grow on all sides. And final words to you, Mandy. What would you say to any international nurse who's thinking about coming to the United States? There are lots of options in the United States now for international nurses. Why would somebody choose UofL?
I really do think it's the family feel and the smaller area feel. There's a lot of really big cities, and you get the same kind of opportunities here in Louisville in terms of things to do and activities and things that the city can offer. But as an organization, we really are kind of what we call a big family, and everyone knows each other. And I think just that support that comes with being in an organization that welcomes you and then works to help you be successful here is special.
Well, you've said a few times, works to set the nurses up for success. So I think that really probably just sums it up. That great family feel, lots of support, and lots of opportunities. So I think that's a great way to end off the show. Before everybody leaves, I want to thank the UofL team for joining us today and sharing some of the awesome parts of UofL, opportunities for growth, for expansion, to challenge yourself. I want to congratulate Beatrice and Faith on their careers and their achievements so far. We feel so proud of both of you, as well as all the UofL nurses and all that you've accomplished. And I know that there's so much more to come with UofL. Before everybody leaves, just remember some of the shows coming up in the next coming week. So next week we have our irregular segment on immigration Q&A, and I know we've had some immigration questions come up today, so save those for next week. On the 5th of May, we have the Kinetics Career Day. On the 12th, we have Nurses Month Game Show. On the 19th, Immigration Q&A. And on the 26th, we have a very interesting show talking about the direct hire versus staffing. And those do two different models. In Lafora, once a month, we have on the 9th of May, work-life balance. Very important topic to discuss how to balance work and life. And remember, every Monday at 6 a.m. Pacific time, check the time zone converter in your location. We have free classes for all of the healthcare workers around the world. We work with Aspire, with IPAR, Swoosh, and Niners. I met most of them when I was in the Philippines last week, and we are so proud to be able to have those partners that give free classes on NCLEX and English requirements. I see Daisy's asking, is this direct hire or staffing? This is direct hire. So you are employed and sponsored by UofL. And also, if we look at the Kinetics initiatives, just a few more things to bear in mind, and that is that we offer free English scholarships for all Kinetics nurses. This is our way of paying it forward for our Kinetics nurses. We have a free NCLEX scholarship for selected nurses, $1,000 referral fee. If you send us a nurse with NCLEX, please listen to our podcast, Nursing in America. We have a direct hire nurse aid program. Every Friday, our show Onwards and Upwards. Every Monday, Kinetics College, free classes for nurses. And we also have many allied needs. In fact, UofL have many of our medtechs that are very happily working at UofL. So with that said, we are over the hour. I want to again thank the UofL team for joining us. We are proud to be associated with UofL, and we will see you next week, everybody. Onwards and upwards. Thank you for joining us. Bye-bye.